All right, ready to untangle this Medicare supplement insurance thing?
Sounds fun.
We're going to be looking at the plans offered through AARP and United Health Care, using some stuff from an AARP Medicare supplement insurance document.
Okay.
It's AARP and United Health Care.
Yeah.
What's the deal with that?
Well, AARP, they kind of endorse the plans, right? And they get royalties, but they don't actually provide the insurance. You know, it's United Healthcare Insurance Company that does that.
Okay, so United Health Care is the one behind it.
Exactly.
But AARP is kind of like, hey, we like these guys.
Yeah, like a trusted friend, giving you a recommendation.
Exactly, and United Health Care is a pretty big name, right?
Oh, yeah, huge.
In the Medicare supplement insurance world.
Yeah, I mean, they're like the top dog.
Really?
According to a 2021 report,
Wow.
they've got a 32% market share.
Really?
Yeah, that's almost 4.5 million people out of 13.8 million.
Wow.
With Medigap insurance.
So before we get too far, remind me again, what is it that Medicare supplement plans actually do? Some people call it Medigap.
Right, yeah.
What's that all about?
So you know how original Medicare, parts A and B, helps cover your healthcare costs?
Right.
But doesn't always cover everything?
Right.
Well, that's where Medigap comes in.
Sure.
It fills in those gaps.
Okay.
Like
makes sense.
Minimizes your out-of-pocket expenses like deductibles and copays and things like that.
Like a backup generator.
Exactly, yeah.
Medicare keeps the lights on, but then you need
a little extra.
Medigap to run the AC and the microwave, right?
Exactly.
But there's so many plans out there.
Oh, so many.
How do we even begin to...
Yeah, how do you even choose?
Well,
AARP highlights these 4 key advantages of their Medicare supplement plans.
Right.
And they call it doctor choice,
okay,
freedom, flexibility,
Yeah.
and access to any hospital or doctor anytime.
That sounds pretty good to me.
Yeah, it's good stuff.
Especially that doctor choice.
Yeah.
So I can see, like whoever I want.
Yeah, you're not limited to a specific network.
Okay.
As long as the doctor accepts Medicare, you're good.
Okay.
And then freedom, that just means your coverage travels with you.
Oh, okay. So, like, if I'm, I don't know, down in Florida for the winter.
Exactly. Yeah, snowbirds rejoice.
Something like that.
You got it.
Then I'm still good.
You're covered.
Okay.
Yeah.
What about flexibility? Does that mean I can switch plans if I need to?
You got it.
Okay.
You're not locked into anything.
Okay, good.
Yeah.
And then the last one, access to any hospital or doctor anytime.
Pretty self-explanatory, I think.
Yeah, pretty much sums it up.
Yeah, I think I get that one.
No restrictions.
So let's actually get into these plans because I know there's a lot of options out there.
Yeah.
And it can get really confusing, right?
Definitely. Yeah.
We were looking at a table earlier that showed some of the plans.
Yeah, there's a lot of them. Yeah, it's like alphabet soup.
Yeah, it is.
It's like plans G, N, L, K, B, A. Like, how do we keep all that straight?
Yeah, it's a lot.
Especially when you start throwing in words like co-insurance and deductibles.
Oh, yeah, that's where it gets really confusing.
Yeah, my eyes start to glaze over when I see that stuff.
Well, let's break it down.
Okay.
Co-insurance basically means you split the bill with the insurance company.
Okay.
You pay a percentage.
Okay.
They pay a percentage.
Okay, so we're sharing the cost.
Exactly.
Okay.
And a deductible, that's a fixed amount you got to pay out of pocket before the coverage actually kicks in.
Got it.
So those are 2 big ones to keep in mind.
So I'm looking at this table, and there's a column for Part B excess charges. What is that?
That's where it gets interesting.
Okay.
So Part B excess charges are basically these extra fees that some doctors charge above what Medicare typically allows.
Really?
Yeah, it's like an overage fee on your cell phone bill.
Yeah. Okay, that makes sense.
Yeah.
They can just charge me whatever they want.
Well, some plans cover it, like Plan G covers those excess charges.
Okay, so Plan G will cover those excess charges.
Exactly.
Okay.
So you don't get hit with those surprise bills.
Got it.
Yeah.
There are also some plans with out-of-pocket limits.
Right.
Right. What does that mean? So that's like a safety net, right? It means there's a cap on how much you're going to pay for covered services in a year.
Okay.
So once you hit that limit, the plan covers 100%.
Oh, that sounds good.
Yeah, it's a good deal.
Okay.
Yeah.
And that's for like Plans K and L.
Plans K and L, exactly.
Okay.
Yeah. So they have those out-of-pocket limits.
And then we've got a bunch of other plans, B, A, F, and C.
Right, right.
They all kind of offer less, it seems like.
Generally speaking, yeah.
Than these top few.
Less comprehensive.
Okay.
Yeah.
So let's actually dive into like the real nitty-gritty details of these plans. Let's do it.
Because I know that's where people really get confused, right?
Yeah, it's the fine print.
It is, and it's where
Yeah, it's a lot to take in.
it gets really complicated.
Definitely.
Yeah.
It is.
So help us untangle that mess.
Okay, I'm ready. Okay, so remember that Plan G,
Yeah, the superstar one, right?
the superstar, exactly.
It covers everything.
It covers a lot.
Yeah.
Like Part A coinsurance, Part A deductible, Part B coinsurance, Part B deductible, even those Part B excess charges we talked about.
Oh.
So it's pretty comprehensive.
That's a lot.
But it does come with a higher price tag.
Okay, so it's going to cost me more.
Yeah. Usually
Okay.
Plan G tends to have higher premiums.
But if I want that peace of mind,
Yeah, if you want the peace of mind.
I don't want to worry about
Yeah, you don't want to worry about those surprise bills.
any extra costs.
Exactly.
Mhm.
Then it might be worth it.
Okay.
Yeah.
What about like Plan N?
Yeah, Plan N.
That was like the savvy shopper.
The savvy shopper. Exactly. It's a good balance
Okay.
between coverage and affordability.
So it covers some stuff.
It covers a lot of the important stuff,
Okay.
like the Part B coinsurance.
Okay.
But it also has copays for certain things,
Okay.
like doctor's office visits
Okay.
and emergency room visits.
So I had to pay a little bit.
You got to pay a little bit, yeah.
Okay.
But you're also saving money on the premiums.
Makes sense.
Yeah.
What about Plans K and L
Yeah, Plans K and L, those are the ones
with the out-of-pocket limit?
with the out-of-pocket limits, yeah.
All right.
So they're like a safety net.
Okay.
You share a percentage of the costs up to a
Okay.
certain point.
All right.
But once you hit that limit,
Yeah.
the plan covers 100% of the
Right.
remaining cost.
So no matter what,
No matter what,
I hit that limit.
hit that limit, you're good.
And I'm done paying.
You're done, yeah.
Okay.
So it protects you from those really big expenses.
Okay.
You know, those catastrophic ones.
All right. That makes sense. So what about the other plans like B, A, F, and C?
Yeah, those are still options.
Okay.
But they generally offer less coverage
Okay.
than the ones we've talked about.
So if I'm young and healthy
Yeah, if you're young and healthy.
and I don't go to the doctor much,
Yeah, you're not too worried about big expenses.
maybe that's a good option.
Maybe, yeah.
But, you never know what's going to happen
You never know. Right,
with your health.
exactly.
Right.
Things can change.
Yeah.
Yeah, so it's important to,
So it's better to be safe than sorry.
it's better to be safe, yeah.
Yeah.
Talk to an insurance agent.
Okay.
They can help you figure it out.
Makes sense.
Yeah.
So we've talked about like the basic coverage
Yeah, the main points.
of these plans.
Right.
But there's always that fine print.
Oh, yeah, the fine print.
Right.
Always the fine print.
The eligibility, the exclusions,
Exclusions, yeah.
the limitations. Like,
All that stuff.
where do we even begin with that?
Well, first of all, you got to be enrolled in Medicare Part A and Part B.
Okay, so that's like
That's like the baseline,
the bare minimum.
the bare minimum.
Okay,
Yeah.
okay.
You got to have that.
And then,
Then there might be other requirements,
okay.
like age restrictions, maybe.
Okay, so I've got to check all that.
You got to check all that, yeah.
Okay.
Make sure you're eligible.
What about these exclusions?
Exclusions, yeah.
Like, what are some things that aren't covered?
Well, like long-term care,
Okay,
usually not covered.
okay.
Vision and dental care.
Makes sense.
Hearing aids,
Okay,
private duty nursing,
okay.
those are some common ones.
Okay, so those are all separate.
Yeah, usually separate.
Okay, so I got to figure all that out separately.
You got to figure that out separately,
Right.
yeah.
Okay.
It can get complicated.
And then each plan can have its own little
Its own little
quirks.
quirks. Yeah, exactly.
Yeah.
So it's really important to read that fine print.
Read the fine print. Yeah.
Make sure you understand what you're getting.
Don't just assume
Don't assume anything.
that everything's covered.
Yeah, that's a good rule of thumb.
Okay.
Yeah.
So let's talk about that travel coverage.
Ah, yes, the travel coverage.
Because I know, like, a lot of folks listening,
A lot of people travel.
yeah, they're retired. They got time
They got the time.
to travel now, right?
Exactly.
And they need to know
They got to be covered.
what's covered and what's not,
Absolutely.
especially if they're going overseas.
Yeah, especially overseas.
Because Medicare doesn't cover that.
Medicare does not cover you overseas.
Right.
Nope.
So what do I do if I'm, in Italy?
Yeah, what if you're eating pasta in Rome
Eating pasta, right?
and you have a medical emergency?
Yeah, what happens?
Well, that's where this foreign travel emergency coverage comes in.
Okay.
It could be a lifesaver.
Really?
Yeah, it's like a safety net.
Okay.
So if you have a plan that covers it,
Okay.
like plans G and N,
Okay.
you're protected.
So G and N cover that.
Yeah, they got you covered.
Okay. So those are the ones to look for.
If you're a traveler.
Yeah.
Definitely.
What exactly is covered, though? Like, if I break my leg.
Well, it's specifically for emergency care.
Okay.
So it has to be a sudden, unexpected illness or injury.
Okay.
Like if you break your leg, yeah, that's covered.
Okay.
But, routine checkups,
All right.
elective procedures,
Makes sense.
those aren't covered.
Okay.
So it's really for those unexpected events.
Okay, so it's not like a free-for-all.
No, it's not a free-for-all.
Okay.
Yeah, there are limits.
Like what?
Well, there's a deductible.
Okay.
You got to meet that first,
Yeah.
and there's a lifetime maximum
Okay.
on how much they'll pay out.
Okay, so I got to read the fine print.
Always read the fine print.
Okay.
Yeah. Make sure
I know.
you're getting what I'm getting into.
Exactly.
So we've covered a lot of ground here.
We have.
Yeah, we've talked about the specifics of each plan.
We have.
We've looked at the fine print.
Yeah.
We've even uncovered that travel coverage gem.
That travel coverage is a good one.
Yeah, it's a good one to know about.
Definitely.
But this is just the tip of the iceberg, right?
So what else is there?
There's a lot more, yeah.
Okay, well, help us out.
Okay, so now that we've talked about all this stuff,
Yeah.
you got to actually think about
Okay.
what do you need?
Right, because everyone's different.
Everyone's different, exactly.
Yeah.
So you got to figure out what works for you.
Okay, so how do I do that?
Well, first, you got to really look at those coverage details.
Okay.
We talked about the big picture, but
Yeah.
it's the details that matter.
The fine print.
The fine print, exactly.
Okay.
So look at what each plan covers, what it doesn't cover.
Yeah.
What are the limitations?
Yeah.
Don't be afraid to ask questions.
Right, because I'm probably going to have some
I'm going to have questions.
after all this.
Yeah.
Yeah.
So figure out what's important to you.
Okay.
Right? Do you want peace of mind,
Yeah.
even if it costs a little more?
Okay.
Or are you okay with a little more risk?
Okay.
You know?
So figure out what my priorities are.
Exactly.
Okay.
And then think about your budget.
Right.
Can you afford these premiums?
Because they can get expensive.
They can get expensive, yeah.
Okay.
So shop around.
Okay.
Compare prices.
Okay.
Don't just go with the first thing you see
Makes sense.
and talk to an insurance agent.
Oh, yeah. They can probably help a lot.
They can help a lot, yeah.
Yeah.
They can answer your questions,
Okay.
guide you through the process,
Okay, so they're kind of like a
personal shopper.
like a personal shopper.
Exactly.
For Medicare.
For Medicare, yeah.
That's a good way to put it.
Yeah.
Okay, so before we wrap up here,
Yeah, before we go,
any last words of wisdom?
don't be afraid to ask for help.
Okay.
It's okay to be confused.
It's a lot of information.
That's a lot, yeah.
Yeah.
So reach out to AARP,
Okay.
United Health Care, an insurance agent.
Okay.
Get some help.
Get some help.
Yeah.
Don't try to do it all yourself.
Don't do it alone.
Ah.
All right.
All right. Well, I think that about covers it.
Yeah, I think we covered a lot today.
We talked about the plans. We talked about the fine print.
Oh, that stuff.
We talked about, those little details.
Yeah, the important stuff.
The travel coverage.
Gems, yeah.
And how to actually choose a plan.
How to make a decision.
Yeah. And that's really what it comes down to, right?
It is, yeah.
It's all about making that decision.
You got to make a choice.
Yeah.
But now you have the information.
Well,
Hopefully,
it's giving you the information you need.
the tools you need
Yeah.
to make that choice.
Yeah. So do your research, folks.
Do your research.
Ask questions.
Ask questions.
And find the plan that's right for you.
Find the right fit.
All right. Until next time, thanks for tuning in.
Thanks for listening.